Very good. So now we're back to do the second part of the programme. And of course, these are the questions that we didn't manage to get to live. And James remains with me in the studio. So James, we're going to get straight down to business because it's a sizable amount. And James, I'm a female in my early 60s. I'm on 5 milligrams of rosuvastatin, 5 milligrams of amlodipine, and 50 micrograms of levothyroxine for underactive thyroid. But is there anything I can take for hair loss? I've only started to experience hair loss since I went on these medications.
Okay, well, what we can do is, what I'd recommend for that lady is number one, I'd like her to go on something called CoQ10, 30 milligrams, one a day, with the Benefits Skin, Hair and Nails for about 6 months. Okay.
Yeah.
And what that does, sometimes they see, did this lady say she started on all of these recently, John?
Yeah, I think so, yeah, from the
Yeah,
gist of it, yeah.
sometimes that can, you're taking 3 new items into your body there, and the body can get a little bit, just a little bit stressed. But, in the main, rosuvastatin, amlodipine and L-thyroxine are mild, and they're quite effective, and their side effect profile is quite low. But in combination, and what we call an atypical reaction, Jerry, by that what I mean is, by the combination of certain medicines or an individual medicine reacting with a particular person, it may cause a side effect like slight hair loss, which I do see quite a lot in more mature ladies. And what I would suggest for that, try the Skin, Hair and Nails, the Benefit Skin, Hair and Nails, because it's got collagen in it and biotin, and it's really, really effective.
Perfect.
One a day.
Now, James, what would you recommend for a man in his early 70s who has just low energy, really?
I would love to see that gentleman on the Benefits Energy Plus, 1 capsule a day, and do it for 12 to 14 weeks. Take it in the morning with the breakfast. There's 42 nutrients in it. It's very safe and it's very, very effective and will give a lift.
A man had swollen feet and was put on a 1 milligram Bornix tablet, a water tablet. It's more or less controlling it. Could you talk about this problem, if you please?
Okay, so swollen feet. So what can happen there, Ger, is that if the heart, sometimes there can be a predisposition towards heart failure. So the heart is struggling to pump the liquid around the body. And what the Bornix does is removes the fluid through the kidneys. So the level of fluid that has to be pumped back is a lot lower. So from that perspective, it doesn't pool in the lower leg area. But what I would suggest to that gentleman, if he got a good support stocking. Now, there are particular types of one that are really, really difficult to get on, and I don't know how anybody can wear them. But if you go in and into some of the better sport shops, they'll have these ones, even a calf sleeve, where you can pull up your calf. And they're really good because they're tight on the bottom, not cripplingly tight, and then they're a little bit looser on top. So you have this natural squeeze going up the leg, and they're really, really helpful, especially at that.
Do you leave that on all day and all night?
12 hours on, 12 hours off. Very simple, Jar. And
does
really
it make any difference whether it's during the night or the day you leave it on?
I would use it during the day. What I found, Jar, I've got a pair of them because I used to do a lot when I was doing lots of running and stuff like that, and I find them fantastic because your legs are not as tired.
Okay.
Yep.
Now, James, are bladder infections any harm, particularly if you bleed with them?
You need to talk to your GP.
Yeah.
That's it, Jar.
Okay. James, what would you recommend for a red rash coming and going on the backs of my fingers and my hands?
Well, if it's not breaking out, Jar, and there's a slight irritation or a slight itch in it, I definitely use a small bit of hydrocortisone cream 3 times a day for about a week. 4 days to a week, Jar, and hopefully that should clear it up. If that's ongoing, you need to start looking at, with your hands washing. Is there an irritation there or something like that? If that's the case, there are a couple of products out there. One is made by a company called TriSwim, and what they do is they do a coating on the hand that you can use, like a silicone coating.
Right.
You can put it across your hand if you're in detergents or anything like that, and it's extremely effective at stopping those type of rashes.
Nice, very good. Now, I hope I get the gist of this. James, I sometimes can get a deep breath and yawn a lot. Any recommendations? Is a deep breath where you sometimes have to gulp in some breath? Yeah. Is that what that means, I wonder?
It's funny, Jerry, yawning is strange. Like I sometimes, one of my colleagues, sometimes we'd be sitting together and he'd yawn,
it's
and
contagious.
then I start yawning. It's
Absolutely,
contagious.
it's contagious, yeah.
So, having a deep breath and a yawn, I don't think there's anything to worry about there. Because sometimes that would happen, like it seems, if you're in company, I've seen that happen before, Jerry, where people are sitting around a table, someone will yawn and it becomes...
it's contagious.
It's a contagious type of thing.
Absolutely.
And, maybe it's psychological.
Like you did it a minute ago, and I'm afraid I have to do it now.
I know what this too is.
Oh my God, James!
Right.
And this isn't April Fool's Day either.
Where's the bed, Jerry?
We have to keep going. You're not getting to bed yet. James, I want to thank you for all you do. I had a lot of burping going on and got some advice from you before Christmas, and there's been an unbelievable change for the better. So thank you for your advice.
That's lovely. Thank you.
A lady in her 30s, James, with hemochromatosis, getting ferritin levels checked every 3 months and all going okay. Now turns out that lipid protein, a test A, resulted in a reading of 152. Could I take anything to bring this down, or is it just genetic? The cholesterol level is 4.6.
Yeah.
What's lipoprotein, James?
It's basically a protein, Jerry, that is identification with your cholesterol, different aspects of that. The reading 152 is highish.
Okay.
What I would suggest there, just a little suggestion there, is a little bit of extra resveratrol and fiber, multifiber plus, for about 2 to 3 months.
2 to 3 months.
So that's resveratrol and multifiber plus, 2 spoons a day for about 2 to 3 months. I'd be interested to see what a result would be at there.
Very good. It doesn't go too far from us, James, that plantar fasciitis is back. What is your recommendation?
Definitely going to a chiropodist or a podiatrist. That's the person, or an orthotist. The problem is, Gerb, if I get plantar fasciitis or Achilles tendonitis, you can go and get an anti-inflammatory, but that's clearing the symptom. It's not getting at the underlying issue.
Root problem.
And the root problem can be sorted with a good chiropodist, a good podiatrist, and an orthotist to looking at your gait, looking at how you're walking, getting support into the plantar fascia area, and that will make a big difference.
Thank you. James, any cure, please, for acute sinus? This person says they are burned out with antibiotics and steroids.
Well, if they're burned out with antibiotics and steroids, the first thing I'd be doing is getting on a good probiotic and a good multivitamin for about 2 months. In relation to acute sinus, I have found that the Zyrtec Plus is extremely effective. And even if they're taking that with a small bottle, a spoonful 3 times a day of propolis liquid, I find that really safe. I find it really effective, and it does help and ease it down. And because the Zyrtec Plus, it's 1 a day, and you just take it during, say, for a period of 1 to 2 weeks.
All over the counter?
Absolutely.
Okay, thank you. Now, not a lot to go here, James, but it's a sore toe. It's a sore toe that's red. Does that suggest infection?
It could be an infection on the left-hand side, so it could be an ingrown toenail, Ger. That's the first thing. If it's a bang of something that they may have got, might need to have a chat with the GP and get a podiatrist or a chiropodist to have a look at it. If it's an inflammation, or if there's any discharge on the side of the toe, they need to talk to their GP.
James, I have an unusual feeling under my tongue. My gums are sticking to my teeth, particularly at night time. It's been going on for about a month now. Any idea what might be causing this?
What's that?
Yeah? So I have an unusual feeling under my tongue. My gums are sticking to my teeth, particularly at night. So it must be like as if there's some kind of like a thick syrupy mixture in the mouth.
Yes. So what I might recommend there, Ger, is that number one, if they pop into a pharmacy and get something called BioExtra Gel. BioExtra Gel. And before they go to bed at night, just put a little bit in around the tongue area and in around the gum area. Right? Yeah. Or even if they popped in and got some Benefits Gel, the Benefits Baby Gel, and just pop a little bit of that underneath the tongue and around the gum area at night, and just see how that goes. If there's no improvement after 2 weeks, GP.
Okay. Can taking milk thistle cause bloating if you're on blood thinners?
No, but you have to be careful about taking milk thistle with blood thinners, because milk thistle is a very powerful liver detoxifier. So, and some blood thinners are cleared out via the liver. So you could increase the capacity of the liver to work extremely well, therefore moving a lot of blood thinner out. So you need to mention that to your pharmacist or your GP.
My grandson, aged 11, is in agony with Osgood-Schlatters disease. Is that right, James?
That's correct,
Osgood-Schlatters disease. Hate him taking painkillers all the time. Any help? So first question, what is that disease, James?
I will have to look that up, Jerry.
Okay. All right.
Have you ever come across it?
Never saw that in my life.
We'll check that out,
Yeah,
Jerry.
it's painful, it seems, the poor child.
Do you know what, Jerry? That reminds me. Sorry for cutting across you there. Another lady last month as well, they mentioned some particular issue, and I must look into it and find it. I might mention them in the next one. Will you remember that, Jerry?
Well, I'll tell you what I will do. You'll do your homework on that, and
I
maybe
will.
if in a couple of days' time that lady makes contact with your team,
Correct.
096 60072, you might be able to give some more advice.
I will, of course. No problem at all.
James, do you stock the herb? Is it yohomamine? It's for cramps. Tom, I'm a truck driver. YOHIMBINE.
I tell you what, Jerry, yohimbe, you can get it. At times, it's basically it would be along the lines of ginkgo and pycnogel, but I would think Tom would be better off taking something like
quinine.
Quinine, yeah. Very, very effective. Now,
Yeah.
that's on prescription, Ger, but you can get it. There's a certain amount in tonic water.
There is.
Yeah. And the other thing, what it definitely, even if you tried it for a month or two, it would be B complex and magnesium, extremely effective for cramp and jar. Or if he's a truck driver, he's out on the road all the time, he needs to be bringing some electrolytes in his drinks.
So what would you recommend there?
Any Airlight, Diorolite,
Okay.
SIS, any of those, really safe, really effective, and really, like if you go up to the car at the moment, Ger, I have a bottle with an electrolyte in it. Very easy, very
And you
effective.
just sip away at your heart.
Sip away,
content.
tip away, and it keeps everything balanced.
Can a caller get antibiotics from a chemist without a doctor's prescription?
No, you can, but it's for specific issues.
Yeah,
Say, for example, like a UTI, but you can't go in if it's a chest infection. So if a non-complicated UTI for a lady comes in, the pharmacist, now the pharmacist who has trained can give that out, yeah? But you have to do the training, Ger. You have to get a certificate for it. So it's very important that the pharmacist will know exactly what they can and cannot give out.
Okay.
But they can give it out, but for specific things around the 8 conditions.
I'm in my late 60s. Can James please recommend what sun cream one should use every day? We spoke about the idea of using it earlier, so would you recommend
I would
one?
use factor 50, Ger, or factor 30 during the winter. But if it's for, did that say it's a lady, Ger?
No, just as in my 60s.
In my 60s. If it's for a lady or a gentleman, I definitely make sure you're taking your vitamin D as well.
On a daily basis.
On a daily basis, 2.5 to 3,000 IU every day along with your sun cream. It's really, really important, Ger, and it does make a massive difference to skin and skin health.
Good morning. I'm just after coming out of hospital with pericarditis. I'm just wondering what the best way is to treat this. I'm on tablets and what to avoid. Thank you. What's pericarditis, James?
It's an issue around the gut area,
Okay.
Ger. Now what I would say is that they're on tablets. I would love to know what tablets they're on.
Right.
Because it's tricky there to make any consult. If that person, if they can give us a buzz, 096600072, that's 096600072, and just mention to what tablets they're on, or just leave a number, we'll have a chat.
All right. Now, funny enough, because there's a kind of a themed question following on from that, is it possible to have a private consultation with you?
It is, Ger, at times, and my wonderful colleague Emma manages that. And if you give a call 096600072 and ask for Emma, she will try and arrange for it. I know I'm a little bit swamped at the moment, but we do our best.
I know,
to help anybody as possible.
What would you recommend for a woman that has low libido?
I would say a discussion with a GP. I would say a blood test to make sure that all her hormones are okay. And I would say
Does age come into this too?
It could be, Ger, and there were suggestions that there was a tablet available in America. I don't know how much that has progressed with that. But if I were her, I would definitely get the blood test done, see where her hormones, see if she's going through, say, perimenopausal, menopausal issues, because sometimes that can have a predisposition towards a lower libido. But all of these things can be looked at and fixed. And even a conversation, I think the most important conversation here is with her GP.
Thank you. And our final question today, a listener was taking a cholesterol tablet called Atrovastin and was getting pain down the arms and the thighs. He stopped taking it and feels much better now, but now isn't taking any cholesterol tablet. What's his advice?
My advice is he has to go back on the tablet or talk to his GP.
Yeah.
The second thing is I'd recommend is he has to go on CoQ10, either 30 or 100, because he's getting pains down his arms and thighs, definitely to get the 100th strength. And you get that in your pharmacy or health food store, and you do that. What I always recommend is with the seasons, but even for this person that they have this particular issue now with pains, because sometimes it's a pre-issue around the likes of rhabdomyosis, which is extreme. I don't want to stress the person out, but if you get CoQ10, they need to talk to their pharmacist or doctor. They need to go back on a cholesterol tablet. The doctor may change the particular cholesterol tablet that they have. That it may not cause a particular pain, but there's no harm in taking the CoQ10, because usually the statins lower CoQ10 in the body, And by lowering CoQ10, you can get these particular issues around pain in the legs and the particular areas.
Yes, you can. Well, James, it's been a pleasure as always. Thank you for all those questions answered. 096 60072 is the number to contact his team or himself at some point along the way. And of course, malloyspharmacy.com, a very extensive website and lots of information there. We'll have you back next month with God's help. Thank you.
Thank you, Ger. God bless.